Gastroenterology, esophageal disorders. In general, esophageal disorders with any degree of anatomic damage that leads to narrowing will result in dysphagia. All forms of dysphagia can lead to weight loss. If dysphagia is present and you do not know the diagnosis, do a barium study first. So the next step to do is barium study for dysphagia. In the stomach, do an endoscopy first if there is any suspicion for a stomach problem. Endoscopy is indispensable for diagnosing cancer, and the precancerous histologic change called Barrett esophagus. Biopsy is necessary to diagnose both of this. Cancer and Barrett esophagus requires a biopsy to diagnose this condition. Dysphagia, that is difficulty swallowing, is different from odynophagia, painful swallowing. Odynophagia suggests an infectious process. If the patient presents with odynophagia, first we have to rule out an infectious process, which includes HIV, HSV, Candida, or CMV. Now let us discuss the different causes of dysphagia. First is a condition called achalasia. Achalasia presents in a young non-smoker, which has dysphagia to both solids and liquids at the same time. So there is difficulty in swallowing of both solids and liquids. There may also be regurgitation of food particles, and aspiration of previously eaten material, that is regurgitated and fallen into the lungs. So this can be a progressive form of dysphagia in which the symptoms get worse over time. Now, what is the best initial test to do if we suspect achalasia? That is barium swallow. Or we can also do a chest x-ray with a bird beak, which shows a bird beak appearance. And what is the most accurate test to diagnose achalasia cardia? It is esophageal manometry, to detect the pressure. Now, other tests includes endoscopy to exclude malignancy. It is not necessary to diagnose achalasia. Manometry to show an absence of normal esophageal peristalsis. Achalasia presents with abnormally high pressure at the lower esophageal sphincter, since it involves a failure of the sphincter to relax. So that is the basic principle or pathology behind achalasia, the failure of the lower esophageal sphincter to relax, which means that it is tightened up. Therefore, there is a very high pressure. Therefore, what is seen in manometry? There is an absence of normal esophageal peristalsis and abnormally high pressure. And we cannot see any mucosal abnormality. Now, what is the treatment of achalasia cardia? It is pneumatic dilation of the esophageal sphincter, that is dilation with the help of air. And what is the risk involved in this treatment? It is perforation. And another important treatment option other than pneumatic dilation is surgical myotomy. Severe disease is treated with peroral endoscopic myotomy. It's also called POEM, and it uses upper endoscopy to reach the surgical site. If the patient refuses both of these, we can use a botulinum toxin injection. Now, the mechanism of botulinum toxin is that it inhibits the release of acetylcholine at the neuromuscular junction, and this in turn inhibits nicotinic receptors and relaxes all skeletal muscles. Now, the next important condition is Sencke's diverticulum. And what is actually a Sencke's diverticulum? So this is actually an outpouching of the, or we can say there's a dilation of the posterior pharyngeal constrictor muscles. The muscles involved are posterior pharyngeal constrictor muscles. So look for dysphagia, a patient with dysphagia plus a bad breath. Sencke's diverticulum must be checked in such patients. And this is probably, the bad breath is probably because of the rotting food in the back of the esophagus. Now, to avoid perforation, we should not endoscopy this patient, or we cannot even place a nasogastric tube in patients with Sencke's diverticulum. And what is the best initial test to rule out Sencke's diverticulum? It is barium study. And what is the treatment? surgically resect the diverticulum, surgical resection. Now let us discuss about the rings and webs of esophagus, which is another important cause of dysphagia. So it is also called as peptic strictures, it is caused by the repetitive exposure of the esophagus to acid, gastric acid, okay, and this results in scarring and stricture formation. Use of sclerosing agents for variceal bleeding can also cause strictures, and that is why variceal banding is a superior procedure to sclerosing agents. So acids and the sclerosing agents are an important cause of this peptic strictures, or commonly called as rings and webs. And similar to Senker's diverticulum, the best initial study is barium study. Now another important condition. Okay, so next let us discuss about the treatment of this esophageal rings and webs. It depends upon the kind of structure that presents. So some of the conditions includes peptic stricture from acid reflux. So in such condition, we can treat this structure with a pneumatic dilation. But if it is a Schatzky ring, or it's another kind of peptic structure, which is actually a distal ring of the esophagus that presents with intermittent symptoms of dysphagia. Okay, the symptoms include intermittent dysphagia in the patient. So how can we treat Schatzky's ring? It is also treated with a pneumatic dilation. And what about Plummer-Vinson syndrome? As you all know, Plummer-Vinson syndrome is a proximal stricture which is associated with iron deficiency anemia and squamous cell esophageal cancer. So this is actually a triad structure with iron deficiency anemia and squamous cell cancer of esophagus, and it is commonly seen in middle-aged women, and it is treated mainly with iron replacement. Now another a note on eosinophilic esophagitis. So eosinophilic esophagitis is mainly associated with dysphagia, and the patient has a history of allergies. So eosinophils are usually associated with allergies. So what we can do is we can do an endoscopy along with biopsy, which shows the presence of eosinophils. And what is the treatment option? That is proton pump inhibitors and also budesonide is another treatment option. Next, let us discuss about esophageal cancer. So esophageal cancer presents commonly with the following symptoms. Three main symptoms are there, or three main conditions are associated with esophageal cancer. First one is dysphagia, which is actually progressive. That is solids first, followed by liquids. Then possible heme positive stool or anemia. And it is often found in patients aged more than 50 who have the habit of smoking and drinking of alcohol. And what is the best initial step to rule out esophageal cancer? Endoscopy. If that is not one of the answer choices, we can go for a barium swallow. Manometry will not be useful since cancer can only be diagnosed with a biopsy. So, if there is dysphagia along with weight loss, we have to suspect an esophageal pathology. If there is dysphagia along with weight loss associated with a heme positive stool or anemia, it could be more of cancer, okay, rather than any benign pathology. Now, just order the procedures you think you need on the CCS cases. Do not wait for a consult. If you need a consult for a procedure, the computer will tell you. Now, what is the treatment of esophageal cancer? Surgical resection. So, as long as there are no local or distant mets followed, we can do a surgical resection. The next step is 5-fluorouracil, 5-foods, commonly called 5-4, and that is the chemotherapy. So first surgically resect the cancer and then followed by chemotherapy with 5-fluorouracil. Use palliative stenting for obstruction. Next, spastic disorders, another cause of dysphagia. Diffuse esophageal spasm and nutcracker esophagus are essentially the same disease. So DES, it's also called nutcracker esophagus. Look for a case of severe chest pain, often without risk factors for ischemic heart disease. Pain may occur after drinking a cold beverage. That is another common cause or a common symptom. There is always pain, but there is not always dysphagia. For DES, pain is always there. We'll do the initial test like EKG, stress test, and even the coronary angiography. It all will be normal, but the patient still presents with chest pain. Then we have to suspect DES. It's also called nutcracker esophagus. And what is the most accurate diagnostic test? The most accurate diagnostic test is manometry. Barium study may show a corkscrew pattern, but only during an episode of spasm. What is the treatment? Treatment is CCBs and nitrates, as you would treat Prinzmetal angina. Okay, calcium channel blockers and nitrates. So they can relax the esophagus. So corkscrew pattern on barium study is seen in DES. Okay. So if the patient cannot use a calcium channel blocker for some reason, we can go for tricyclic antidepressants. Now, another important cause of dysphagia is scleroderma. It's also called progressive systemic sclerosis. It presents as symptoms of reflux as well as colonic dysmotility. What is the treatment? Treatment is proton pump inhibitors. Esophageal disorders can mimic Prinzmetal variant angina because the pain is sudden, severe, and is not related to exercise. That is, it is occurring at rest. But Prinzmetal angina will give you an ST segment elevation and abnormality on stimulation of the coronary arteries, while esophageal spasm will not show that. And the one is esophagitis.